Go ahead, Aaron.
Yeah. One of the things you're famous for is your 7 goals for a thriving practice. And I know a lot of your clients, work with you to help not only make progress in one of these 7 goals, but many of them make progress in 5, 6, some even make progress in all 7 goals in 1 year. Can you outline what those 7 goals are getting?
You read my mind, Aaron, because I wanted to go next from SMART goals to let's get this very specific to dental practices. And we have in our Thriving Dentist Coaching, we have 7 goals that are part of our curriculum and part of the mindset that we create and part of what we work with every one of our clients to achieve. In addition to their goals, they're more micro goals. We have these 7 more bigger picture goals of what we're trying to accomplish. And I'll number them 1 through 7. They're not numbered in importance, but they're numbered so I can remember to cover all 7. Number 1 is we want to control your overhead. And if you're a solo dentist practice, we want overhead no higher than 60%. And that would include all the necessary expenses in your practice, excluding doctor income. So if you're a solo dentist, we want overhead no higher than 60%. If you have 2 or more doctors, we use a different measurement. We measure EBITDA. We use an acronym EBITDA, earnings before interest, taxes, depreciation, amortization. So if you have 2 or more doctors in your practice, we want to have EBITDA of at least 20%, after paying all the expenses of the practice, including paying the owner dentist. So number 1 relates to overhead control. Goal number 2, we want to create have you the ability to create financial independence from your practice. What is financial independence? This gets to the measurability of this and the specificity of this. That's the day where you can reproduce your income without going to work. When you have enough resources in the form of your investments, it could be tangible investments like real estate and other holdings. It could be in a pension plan where you could reproduce your income every year without going to work. So Naren, just hypothetically, if a dentist had annual income of $350,000 a year, I'm making up a number. When you have resources over here that can produce $350,000 a year in income without ever touching the principal, then you're financially independent. Now you can go to work because you want to, not because you have to. How do you like that goal, Naren?
I love it.
And that goal is not achieved very often in dentistry. Sadly, the ADA tells us that only 3% of dentists in the United States, 3%, can retire at age 65 without reducing their lifestyle. So we're on a mission to change that. Number 3 is we want you to have a state-of-the-art office and all the technology that makes dentistry fun for you and more effective for your patients, and still control your overhead in the appropriate levels. So I want you to have a state-of-the-art office with all the technology that makes dentistry fun for you and more effective for your patients, and still control your overhead. It just got harder, didn't it, Naren?
Yes.
Goal number 4, a high-performance team that you truly love and enjoy working with. High-performance team you truly love and enjoy working with. Goal number 5, patients you enjoy taking care of. You don't have to love your patients, but I hope you enjoy taking care of them. If any of them cause you to lose heart muscle and stomach lining, they need to be somewhere else. Goal number 6, treatment mix that gives you satisfaction. Treatment mix that gives you satisfaction. Whatever that is. And that's got to be self-defined, because when it comes to your treatment mix, what one dentist loves to do, another dentist doesn't enjoy doing. So you got to pick that yourself. And we want you doing more of the kind of dentistry you want to do, because it makes coming to work a joy. You come skipping into work. It's TGIM instead of TGIF. And finally, goal number 7 is we want to achieve an effective work-life balance. An effective work-life balance. And that's got to be more specificity has to be put to that. And we work with our clients to define what that is. How many days a week do you work? How much vacation time do you take? How much CE time do you take? How much time do you take for personal reflection? How much time are you able to devote to your personal fitness and health and wellness? All that has to be factored into that. Those are the 7 goals that we work with every single client. And every one of those can be filtered through the SMART acronym. Every one of those can be filtered through that SMART acronym. But when you have those, go back to some of the things I said earlier. You're going to reduce the likelihood of having burnout because you're always working towards something. Like my grandmother, as I remember being 5 years old, and she always had me looking forward to something. Now you're always looking forward to something. You're looking forward to doing the things that'll help you achieve those goals, and that's going to help you radically reduce the burnout that so many dentists experience. And you're going to be modeling the concept of accountability in your practice, because now you're demonstrating what you're expecting from your team members. And all of this comes together to create a thriving practice, one that is absolutely thriving. I'll give you another context as we wrap up today on the concept of accountability. Many of you know the influence that Dr. L.D. Pankey had on my life. Tremendous influence. That it just, I can't even categorize how much of an influence he had in my life. And Dr. Pankey talked about, you probably are familiar with the Pankey Institute. You maybe know that I'm part of the faculty of the Pankey Institute, and I spend a specific time every year teaching in Key Biscayne, Florida, as part of their faculty on both the business and the behavioral side of dentistry, the business and the people side of dentistry. Dr. Pankey developed what he called the ladder of achievement in dentistry. The ladder, the master, called the mastery ladder, like a, like we're climbing onto the roof on a ladder. And he defined in his research that there were 4 levels of achievement. I'll start at the very top. At the very top of mastery was 2% of the dentists would achieve the mastery status, would truly be a master dentist, where they could do anything clinically to a very high degree of performance. They could do it, they could teach it, they could write about it, and they truly had achieved mastery. 2% of dentists will achieve that. The next rung on the ladder was 8% of dentists would be highly accomplished. These would be dentists that were very, very accomplished clinically, but not quite at the mastery level. The next rung below that was 36% of dentists he called students. Now, they weren't students like dental students, but they were students in the context of dentists that were on the path to achieve highly accomplished or become master dentists. And then the bottom rung of the ladder, if you do the math, it's 54%, which is the majority, were indifferent. Naren, what does it mean to be indifferent? What does that mean?
They don't really care. They just
don't care.
Just punching the clock, and
they're just going through the motions.
Yeah.
Now we know that none of you as listeners to this podcast fall into that last category. We know that. But where do you want to be? Where do you want to be? And finally, the last question I would ask you to ask yourself is, what are you going to do to get there? If you want to be a master dentist, what are you going to do to get there? And therein, maybe will lie some direction for you creating your own goals. Well, I hope this has been useful. Fun episode. We've got some great questions coming up. Let's hit pause here and go to the Q&A segment where we can go into more depth on some of these details.